We have a question. Mayor Stewart, the city and the Board of Education are under several different health insurance contracts. Why not one plan for all, and would that be a cost savings for the employees?
A difficult issue, extremely difficult issue, given the fact that people want different things in their health insurance. We provide a menu of options for people. We have over the years at the city, at the Board of Ed, different plans, whether it's a PPO plan or the old indemnification plans. They vary from board to city. Over the last probably 2 to 3 years, we've seen an escalation in healthcare costs, probably to the tune of 16–18%. To the city of New Britain. It's an enormous piece of the city's budget to the tune of about $21–22 million. This year, in the collective bargaining process with a number of my unions, I proposed to them, which there is an out in probably all of your contracts too, that says the city reserves the right to go out to an alternative provider should they find cheaper coverage, as long as it provides the same level of service to people. That has to be looked at. You know, if the city, in and of itself, with the number of employees that it has, can provide its own HMO plan, if you will, it stands a chance of saving some significant dollars. We're already self-insured. Some of these proposals at the state level that were proposed to have everybody join in on are not going to save the city money. We're already self-insured. The state isn't. The state going to a self-insured plan will save millions of dollars, but the city's already there. I think part of the issues really are to make sure that we all have the same benefit levels, because you'll get some cost containment if the benefit levels are the same throughout the city. They are not, and I can tell you that for a fact. You know, different unions have different benefit levels, and always, you know, higher echelon employees want to have better benefits than the lower employees, and so on and so forth. And that does create a cost differential that we end up having to pay for. I will tell you that, you know, the other issue with many folks is the fact that we in the city now have merged with the Board of Ed on our brokerage services. The board was losing tons of money several years ago because of the way that they were paying out the brokerage fees to the health insurance provider. And we were able to stop that a couple of years ago and saving, it's got to be hundreds of thousands of dollars to date, because we pay a flat fee to one person who covers not only the city side, but the Board of Ed side. And he negotiates, and as a part of the negotiations process, his name is Tom Doyle with TD Bank, has provided that service for us for several years, and it's been a real cost savings to the cities and the Board of Ed specifically. So, you know, we have to look at the bigger picture here, and the total costs are enormous. They're absolutely enormous. I think HSAs and other types of options are viable for people, especially healthy people that don't need services all the time. So you can start to break out some of those costs for people and allow them to save money. And I think all the while, the city has been a willing participant. I know with several of my bargaining units, I propose being a partial funder of that to get people into different systems that are much cheaper for the city and eventually save money for taxpayers.
Senator O'Mike?
Senator.
Representative. I just.
Don't let Don DeFranco know you said that.
No, I won't. He's not here, is he?
No.
Okay.
We're safe. This actually brings up a very important issue that I've been working very hard on in the state legislature, and that is a piece of legislation called the Healthcare Partnership Act. And that's something that would not only allow for the school system and the city to have a state health insurance plan, but through negotiations to be able to get all those plans through the state employee system, which we conservatively estimated would save the city of New Britain around $900,000 in costs. It is, and by the way, the state of Connecticut is now self-insured. That's one of the changes that we made in this year's budget process. So that's another opportunity for real savings. This is legislation that would not just expand quality health coverage, quality affordable health coverage to cities and towns across the state of Connecticut, but it would also allow small businesses and nonprofit organizations to access that same health plan too. And as I've gone door to door in our community, there are many people who are either self-employed or work for small businesses, and I ask them how much gets spent on their health care. And if we had this plan, they would pay less for healthcare, for a better healthcare plan. That's something that I think as a community, as a city, we should be helping to support. When there are policies like that that are being discussed in the state, we should be wholeheartedly in favor of it. This is something that can save money and expand healthcare coverage and make it so that we could have quality, affordable healthcare coverage for all of our municipal employees on the Board of Ed and on the city side. And I think it's something that we should do. Thank you.